Hi, I'm Dr. Nanda Rajaneesh, surgeon from Apollo Spectra and Sakra World Hospital. I like to talk to you about gastro-esophageal junction. We know that a lot of people are suffering from acidity and reflux of an acid. So, just to know anatomically, the G junction has a definite mechanism to prevent the reflux of acid. Okay, so what are those mechanisms? One is angle of His, the stomach being like this and the esophagus going up like that. There's an angle which prevents reflux of an acid, that is called angle of His. Next is the mucosal folds of the esophagus and duodenum, esophagus and the gastric junction, they themselves act as a valve, that is called mucosal valve. Then there is a pressure gradient between the stomach and the esophagus. The esophagus is collapsed and stomach is widened. So that pressure gradient itself prevents the reflux of an acid. Okay, and also the diaphragmatic crura is a muscles which hold that angle of His also, which also collapse the cavity so that reflux doesn't happen. Even after this, if the reflux is happening, that means this whole of this mechanism is into toss. So how does that happen? One is hyperacidity. When the hyperacidity happens, the stomach is completely disturbed and it's irritated. You can say mentally how we get irritated, the stomach is irritated. So it takes off all the mechanisms and the signals, the vagus and sympathetic signals will get into disturbance and the reflux happens. So patient will have burning and acid coming into the throat, even food coming into the esophagus and severe burning here. These are the problems that happen. So in many of my videos I have already talked about how to prevent this. This is a treatment, definite mechanism of treatment. We'll talk about in one of the next videos. Thank you.